Okay, so in this video we're going to see what are the body movements, and starting from moving anything away from the midline like your arms, that will be ABD, abduction. Moving closer to the midline, that will be adduction. So we can do this abduction like this, or adduction. Naturally we are adducted. And then bringing together two bones, closing the angle between two bones, that's flexion. And then away will be extension. Now here, at least in our head, we can do hyperextension like this. Okay, we cannot do hyperflexion. And then our knee, for instance, is always extended when we're standing up, but when we flex it, like when we are sitting, that will be flexion. Okay. And now for our foot, we have plantar flexion, which is bringing your toes down, or you can do dorsiflexion, which is moving your toes up. And now, sometimes when we're walking, if we step on an uneven path, your sole can go in, and this you call it inversion. Now, if for whatever reason your foot goes like this with the sole to the side, that would be eversion. So those are movements of the foot. And now for arm. So we have in the natural anatomical position, which is this, we have the palm facing anteriorly, but if you put it like this, that will be supination, like if you were asking for soup. That's supination, bringing your palm down, that will be pronation. And then for our fingers, when either your pinky or your thumb opposes, that will be opposition, and then bring it back to the normal position, that will be reposition. So opposition and reposition. The other ones, they cannot do that, so they can just flex or extend. And then of course, when you find out your fingers like this is abduction, and this is adduction. Okay? And then for movements of your jaw, bringing your jaw anteriorly, this is protraction. Bringing it backwards, that's retraction. Bringing it up, that's elevation. Down is depression. And then moving to the sides, your jaw, that will be lateral excursion. So those are specific movements from your jaw. Now, elevation can be doing this, shrugging your shoulders, or depression, bringing it down. What else? So I said extension, hyperextension.
Professor.
Well, you can combine them, like this is flexion and supination, or flexion and pronation. And then, for instance, when you move one of your flexor carpi ulnaris or extensor carpi ulnaris, you can do this. Of course, you can adduct in the case of the ulnaris, or abduct in the case of the radialis, and you can be doing this type of movement. But I think rotation. So rotation is basically bringing towards the midline as well, but in a circular way, any of your limbs. Like for instance, this is medial rotation, okay, or lateral rotation. Circumduction, where can we do it? In our shoulder and also in our hip. It's 360 degrees. But I think those are all the body motions.